So healthy behaviors, we have certain healthy behaviors that we know going in. We will start out the program with, and they are relatively basic things like establishing a relationship with a primary care physician and going for a physical, participating in a health risk assessment so that the health plan can develop a plan of care specific to that individual. We will reward individuals for not utilizing the emergency department in the preceding quarter or 6 months. So those sorts of things. As we get more sophisticated with the model, it will be more targeted to an individual member's needs. So, for example, an individual with asthma can earn healthy incentives by participating in an asthma disease management program, as an example. The healthy incentive participation isn't going to dictate whether or not a person loses coverage, but rather whether they earn credits into an account that they can then use to offset their copays. So someone would not be disenrolled for not participating, for example, in an asthma disease management program, but they also would not earn the money that then could then be used to offset their copayment when they go to their primary care provider. So that's how that.
And forgive me for not understanding. Is that the $8 copay that they're earning, doing all this extra work to try to offset?
Or
$8
or the $75 copay for a hospital admission. Yeah, and you're talking about individuals, many of whom make less than $11,000 a year, and so I know that those amounts can seem small, but particularly for someone with a chronic health condition that's having to go to a physician frequently, they can add up.